Hi everyone, my name is Liana Laughlin, and it's been around 1 week since we've done the eye fillers and the silk peel for my face. And as you can see, my eyes do not only look brighter from the procedure, but it made my overall face look brighter. And for the silk peel, as you guys seen in the last video, I had like tiny acne. As teenagers, we all go through those things because of our hormones and oil. But now, like, my face has never been more smoother and like baby skin. For our next procedure, we will be focusing on our lips, and we will be doing lip fillers to make my lips more plump and beautiful looking. I'm not really like insecure with the shape and size of my lips. I do love my lips as how they are, but in this generation, it has become a trend to make your lips more bigger, and you see a lot of celebrities who do lip fillers for a more picture-perfect face. Don't forget to click the subscribe button and press the notification bell to keep you updated.
Good day everyone, welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. Have you ever wondered that your lips are the most alluring and eye-catching features of your face? That's why they deserve our attention. Fuller and well-defined lips could significantly increase the overall facial aesthetic appeal. So in today's episode, we have a topic on lip reshaping or lip enhancement. And we have with us again, Miss Liana. Welcome back, Liana. Okay, just a review. So we have done under eye dermal filler, and we also did the silk peel on Liana. How many weeks ago, Liana?
1 week.
Oh, 1 week. So right now I'm checking on Liana. After a week, I've seen a great improvement on the skin under the eye, and also her skin is a lot better. So the comedones, the papules I've seen a week ago, they're now gone. Right. So what is your comment on that, Liana?
Well, it feels very nice because when I wash my face, I don't feel any bumps. I feel like I have baby skin again.
So silky skin again.
Yeah.
Okay, so we just wanted to remove those comedones, those clogged pores there. We also did some facials on you, right? Few days ago, just to further cleanse the skin and degrease the skin, and of course decongest the pores. So you also have to really do a maintenance skin care, and of course your home skin kit, whatever you're using. So it's more of a gentle maintenance because you're still a baby. She's still a baby. So you don't need those very harsh or very strong chemicals or anything you put on your skin. Okay, so right now, since Liana is also preparing for a great event, a big event, right? It's like a virtual pageant. Wow. So on the screen, on the camera, you should really look great. Okay, so from the upper third, middle third to the lower third. And today we wanted to like do an enhancement on the lip region. And Liana is still young. How young are you?
18.
18. Okay. So you think she needs it now? Well, actually for Liana, their generation right now, it's more of like being like a picture perfect look, something like that. And it's more of enhancing facial features, highlighting facial features. So she's still a baby. So it's like not really altering what your looks are, but it's enhancing what you already have. Right?
Yeah.
So we just wanted to emphasize the lip region in a way that we wanted to give it a contour, a definition. Because she has a very good volume on her lips. There's already that good shape. We still wanted to further enhance or show those nice features of our lips. Okay, so like for example in the cupid's bow part, so we still wanted to bring out that cupid's bow as well as the philtrum and the vermilion border. Okay, it's not really making your lip very or too much pout or like a duck lip, right? The others have that too much of the lips. It's just, you know, still within balance or proportions, right? Still should be harmonious to the entire face. So in today's episode, we have another non-surgical procedure, the lip enhancement. It's more of emphasizing our lip contour, the lip borders. Okay, so we'll show the actual procedure when CSA Medical Aesthetics return. Back, we are talking about lip enhancement. So let's have a review of the anatomy of the lips. Okay, so we have the center part here, which we call the cupid's bow here. It's like a letter V. Okay, and then at the upper area we have the philtrum column or philtral column, and in the center we have the philtrum. And now at the outer border of our lip we have the so-called vermilion border. Okay, and the body of the lip is called the vermilion. So we have the dry and the wet part, and then on the corner we have the oral commissures. Okay, so in doing lip enhancement, we also want to emphasize the so-called lip tubercles. Like in the upper lip we have a center tubercle and two lateral tubercles, and on the lower lip we have lateral tubercles here. Okay, in terms of the vascular supply of the lip, it's from the superior and inferior labial arteries that are branches from our facial artery here. Okay, and then we have to also follow the rule of thirds. So on the lower third of the face, we can subdivide it into the 1/3 and 2/3 rule here. Okay, now in terms of the projection, the upper lip should be about 1 to 2 millimeter projected than the lower lip. And in terms of the thickness, or rather the length, so we say that the upper lip compared to the lower lip, there's more of this length of the lower lip. Okay, so in doing procedures like this, we follow the so-called rules of proportions, and also we want to have a good volume and a balanced or symmetrical lip structure. Right, Diana? Okay, now the procedure that we will be doing will be the injection of our hyaluronic dermal filler. So hyaluronic is a natural substance that is also good for volumizing the lips, rather restoring the volume in the lips, and also contouring the border of our lips or giving that further definition of the lips. And if you also wanted to have a very good cupid's bow and also this well-defined philtrum, you can make use of our hyaluronic dermal filler. And you can also improve the texture of the lips. Like if you want the lips to be supple or softer, you can make use of our hyaluronic. Take note, hyaluronic attracts water, so it's still gonna volumize and hydrate our lip body. Okay, so before we do the procedure, Liana, do you have any questions?
I'm just concerned because I researched about this before we did it.
Yeah.
And I saw a lot of like bruising pictures.
Yep.
So is that gonna happen?
Okay, so that's a very good question. I've mentioned a while ago vascular supply of our lips from the superior and the inferior labial arteries. whenever we do puncture or injections, making use of our sharp needles, of course, you expect some of the hematoma effect or bruising or swelling or redness effect from the injection or from using the needle. Some tend to bruise, some do not tend to bruise. So it depends also on our clients. Some are taking some aspirins or any blood thinners, they tend to bruise. Or some people are just genetically speaking, they tend to bruise. But when we did procedures on you, Liana, remember, like the under eye region, did you have bruise there?
Nothing at all.
Nothing at all. Okay. So with that procedure, we made use of cannula, which is a blunt needle. In this procedure right now, it will be a different technique. We'll be using cannula for less bruising. So I know your concern is the bruising. So we want to have a different kind of technique. We want to use another type of material, and that is our cannula. Okay, so for our cannula technique of lip enhancement, so this is a different kind of a procedure right now as compared to the others whereby we keep on using our sharp needles. Right now we'll be using the cannula, but we have to identify which will be our entry point. Okay, so for the entry point, it will be on the oral commissures. Okay, so we can fill in both the upper and the lower lip. So as much as possible, we reduce the number of entry points. So at this point of time, we'll have 2 entry points, one on the right and one on the left. Okay, so before any procedure, follow again a sepsis rule: cleanse the area, cleanse, sanitize, disinfect. And then we did also apply topical numbing cream on the surface area, and you can also make a mark on the oral commissures and then inject like a 0.1 to 0.2 ml of your lidocaine, so which we did already a while ago. So we can clean again the area with our like Chlorhexidine or any disinfecting solution you have. So our entry points will be on the lateral side of our oral commissures. So when we say oral commissures, these are the corners of the mouth, and actually as we age, the corners of the mouth tend to go down and it causes a look of like a sad look, right? So we wanted to maintain that happy look. So once you have already your entry point, you make a tiny puncture on your entry point. So I'm using a gauge 23 needle here. So you use a low molecular weight hyaluronic dermal filler. So I have my entry point here and I'm using a gauge 25 needle. Okay, and with that you can just glide your cannula first on the upper lip. We'll be working on the upper lip body, so you can be in a superficial plane because we're only using low molecular weight dermal filler. Now once you reach your end point, so end point could be on that peak of your V shape on the cupid's bow. Okay, so you may wanna stay on the vermilion border first. Okay, there you go. So some pressure there, Liana. Okay, and then just push small amounts of your dermal filler. Okay, just a small amount only. And it's a linear retrograde threading technique and a slow push. And then, so once you're out, you can make another pass inferiorly. Okay, so you're in a superficial plane again, so you may want to fill in also the body. So a while ago we filled in the border. Now we can go to the body of our upper lip. So just glide, and I noticed that there are some cracks on the lip, upper lip and lower lip. So maybe Liana needs to drink a lot of water. Okay, Liana? So just glide there. I'm just very careful, okay, in gliding our cannula. Take note, we're using a blunt needle. It's not the sharp needle. So I'm in a superficial plane. So I wanted to stay in that plane because we wanted to also avoid some of the vascular tissues under it. So take note, the blood supply or the vasculature is at the submucosal region. Okay, So I'm done with the upper. Now I'll do the lower lip, same entry point. So this entry point is very convenient for us since we can use this for both upper and lower lip on this right side. So our oral commissure, like about few millimeters lateral to it, you can make your entry point. So you have to be perpendicular at first and then just glide. So start with the border of the lower lip. So I'm just gliding it onto the lower border. So we have some resistance, which is expected since there are some tissues, musculatures on the corner. We have the vernier the modulus. Okay, so I'm on the lower lip already, and I'm gonna fill in the body as well as the border. Okay. So we are proceeding at the left side. Make your puncture on your entry point. Few millimeters lateral to your oral commissure. Sponge, please. So you have your gauge 25 again, and then perpendicularly insert the tip of the cannula and then glide it towards the vermilion border of the upper lip first. So some pressure there. So I wanted to stay as much as possible superficially. So we want to insert our filler into the superficial plane. Okay, and you can reach the peak of that V in your cupid's bow. So I'm already in that tip, and just small amount. So less is more, as they say. When you inject your filler, you don't need to overfill. Take note, the fillers are attracting water. Okay, and then let's do a fanning technique. So another pass, you can already go inferior to your first pass. So I'm trying to stay as much as possible on a superficial plane. So I wanted to fill in the body of the vermilion, or the vermilion itself. Okay, so filling in our vermilion body. It's a good technique because we minimize the bruising. Right. So we're now doing the lower lip on the left side. So I'm gliding the cannula into the vermilion border of the lower lip. So I'll advise Liana to drink a lot of water to hydrate our lips. So our alluring lips. So this is very good for those people who have dry or dehydrated lip, or those with like a rough texture of their lips. It's gonna be very nice because when you do your like your makeup, when you apply lipstick, so your cosmetic products can stay longer into your lip, and it's gonna give a better look of the lip. So I'm now gonna fill in the body of the lower lip, and then pushing our dermal filler. There you go. Okay, so we have done our lip enhancement using our hyaluronic filler. We'll show the result to Liana when CSA Medical Aesthetics returns. We're back mga ka-CSA, so let's now show the treatment outcome to Liana. Liana, here's our mirror. Okay. So we did our lip enhancement procedure using our hyaluronic filler, and we had a so-called cannula technique. The concern of Liana is she doesn't want to have that bruise in the body of the lip, so we use the cannula to reduce or prevent that bruising effect. Because whenever we make use of our sharp needle method. Of course, you're injecting with a sharp needle, so there is a chance of hematoma or bruising. And with our cannula technique, we only had entry points on the sides of the oral commissures. Okay, so we will be advising Liana to do ice compress and also avoid food that are high in allergogenic substance, and no heavy or strenuous activities at the moment, because we'll still check Liana 2 weeks from now. We wanted to see how the filler settled in, because these kinds of dermal fillers, they have good tissue integration. So they will blend in and they will also bind and give that more natural effect or result as days pass by. So we'll have again a 2-week follow-up for Liana. So this is making use of the dermal filler to produce a fuller or well-defined, well-contoured lips, or also I should say alluring lips. So the young ones right now, because I have clients that come to my clinic, they show me pictures of different kinds of lips, different kinds of volumized lips or full lips. Some would want the heart shape, some would want like in the middle there's no tubercle, some would just want to have a plain or just a minimal enhancement, but some would really want over enhancement, or they would really want to have it fuller or really full pack, or really a lot of volume there. Or some would want it thicker, and some would want it like the upper lip should be thinner and lower lip thicker, or the upper lip thicker, the lower lip thinner, something like that. But of course, we still follow the rule of proportions, harmony, balance. It should really be balanced to the entire face, so it will give you that overall aesthetic appeal. Okay, Liana? So actually, Liana right now has this feeling of numbness because the filler also has a lidocaine with it. That's why during the procedure, as we insert our cannula, there's this comfort, so she's okay. At first, of course, you feel some pressure, but in a little while, because of the lidocaine in the filler, the discomfort is going away. Okay, so would you want to say something, short something, while we're waiting for the healing of the lip area?
I can definitely see the puffiness already.
Yes, yeah, right. And since Liana, we could see that she's from a European descent, right? She's half Filipina and half Irish, right? So, because in Europe, I see a lot of females wanting to have really a puffier or really like big or more of the lips. They wanted to really give that big emphasis on the lips. They wanted it fuller. So if you can see pictures of European women, they want their lips really emphasized. Okay, really alluring, sensual, seductive, and what else? Luscious lips. Okay. Oh yeah, we've learned something today. Okay. If you have any questions, you may email us at csaskinclinic@yahoo.com, our FB page CSA Medical Aesthetics, Instagram CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Francisco G. Nepomuceno Avenue, Pulong Marugol, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. We have more topics, a lot of discussions. We even had former topics on lip enhancement, lip augmentation. That one using a sharp needle technique, and actually we produce a different shape of the lip. For Liana, we did more of like a version of the lip. Okay, we wanted to really give volume on the body as well as definition on the borders. Okay, thank you, Liana. We'll see you again in your follow-up. Thank you so much. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.